Good day, everybody. I am Dr. Anil Sangle, consultant neuro and spine surgeon, and I have with me S. Shripad, who is a certified financial planning professional and an advocate. Today, we are going to talk about various aspects of the brain, the mind, the mental health, especially in children, with respect to a financial planning perspective. I would like to ask Shripad, with respect to the financial planning, what exactly happens in the planning scenario in children who have a lot of mental problems or who have problems with respect to the brain related to some sort of a trauma or an injury or an infection, which happens very commonly, especially in India. So, when a child starts developing right from childhood, up to say probably adolescence and getting into adulthood, there are various stages in the development of the brain, and if there is any obstruction to the development in the form of a trauma or an injury or an infection or a tumor or whatever, the mental aspect and the physical aspect, both of them get hampered, and this causes a lot of problems to the further development of the child as a whole. In this scenario, there will be a lot of financial planning problems, especially for the family. In the Indian scenario, it is much more evident. So, how do we do the financial planning? What exactly is the scenario? How do the courts and the various judiciaries help the planning of these things? I would like to ask Shripad with respect to this. Hi, Shripad.
Yeah, hi. Thank you. First, I would like to tell you what financial planning is. Financial planning is you're going to plan your finances for the unknown future. And there are certain areas which you can plan, like if you want to have education for your children, or if you want to set aside some amount for marriage expenses or for your own retirement. These all come under the aspects of financial planning, the grossly. And the scenario gets more aggravated where there is a child which is suffering from neuro ailments or mental illnesses, and you have to not only devote your time but also your finances for bringing up the child or making it into a normal being in the society. So, and financial planning for families dealing with such serious mental illnesses and neuro illnesses or neuro ailments is unique. And the impact of illness will be highly affecting the parents' future financial planning, because they can't set aside all the amount. If you don't have any problems, you can utilize.
This is an unforeseen event.
Yeah.
And because of this event, there will be a lot of other financial burden apart from the normal financial.
These are extra financial burden,
Yes.
which you could not have
not even
anticipated. And a parent of a child with more neuro disabilities, it certainly impacts more burden on your finances. And if illnesses are known at an early stage of the child upbringing or in the development of the child, say 3 or 4 years, at least you can make certain arrangements, financial arrangements, because you will also be young, that is, the parents will be young and the child will also be young, and at least you know what should be done. But if it happens midway, say in the late teens or in the mid-teens, then it will be a huge financial crisis for the family.
Much more than what it would have happened if you are knowing the particular ailment as soon as the child is born or in the early childhood.
Yeah. And there are certain aspects in which the Honorable Supreme Court also has helped in such situations. I'll take a case of a young girl who was 12 years old. She was very bright and she was a normal young girl, but she was hit by a truck in October 2007 and suffered brain damage. And because of this, consequentially, she had a low IQ, and she had severe weaknesses in all her four limbs, and she suffered from hysteria, urinary incontinence, and her disability was assessed at 100%.
100%.
So at this point, I would like you to bring in some information on the brain development or something related to neuro ailments, especially in children, because I am taking up the issues of financial
With respect to
planning
children, yeah.
and in children. Can you just highlight some information on this?
See, children are usually born ready to learn. The type of development that happens in the mother's womb is so nice, it is so good that a fully formed normal fetus, when it is born, will have with a normal physical and mental milestones. You can expose them to multiple languages, multiple sorts of stimuli, and everything gets grasped by the child. And that also depends on the genetics and the intelligence of the child, the amount of nutrition that's being given, etc. And basically, the way in which the child is being brought, the language, the communication skills, all these things, and the schools which they go in, the avoidance of certain types of childhood infections like tuberculosis, mumps, measles, etc., with respect to various sort of problems which we see, especially in the tropical areas. All these things have to be taken care into. Now, coming to this is a very common problem which we see, and it is not only in children but also in young adults and even in elderly people. Being hit by a truck, being hit by having an accident is extremely common. Regarding the causes and the reasons of all these things, we'll go into something later. But the impact of the injury to the child is really phenomenal. If the child is still in the growing stage, see, the neurodevelopment takes place right from the development of the child in the region of the womb, and over a period of several years, even after birth, up to 5 to 8 years, even the skull keeps growing and the number of neurons keep on increasing. This neurodevelopment is a very complex, dynamic, and precisely orchestrated problem, and it's also dependent on the genetics and the environmental factors, biochemical factors, so many things. When this gets hampered, the type of neurons that get damaged are the ones which will cause the particular type of a problem. For example, you said this child had a 100% disability. 100% disability, as far as I know, means the child is not able to understand, the child is not able to cognize, the child is not able to respond to stimuli, they not able to ask for needs, and it is just like a vegetable lying down and requiring complete help for all activities of daily life, like bathing, eating. Even if it coughs, somebody has to remove the sputum, and for daily needs for passing urine and motion. All these things have to be taken care of for the child completely without any sort of help from the child. That is a 100% disability. And many people, like we see in a routine practice, we have patients having 20, 30, 40, 50% disability. And there are various guidelines where you have the disabilities, how to document these disabilities. But in the human brain, what happens is the number of cells in the human brain are in billions and trillions. For example, if I tell you, the average human brain, adult human brain, has a volume of about 1,350 to around 1,400 or 500 cc, cubic centimeters. And the surface area will be around 1,820 to 1,900 sort of square centimeters. And the thickness of the cortex of the human brain will be around 2.7 millimeters, and there will be hundreds of billions of neurons and almost about 7,000 synaptic connections per square. That is about 0.15 quadrillion synapses. That is a junction where one neuron attaches to the other neuron. So that's something phenomenal, and you cannot even imagine such things. And the damage there can disrupt the whole network. For example, if wires in the vicinity, electrical wires or telephone wires, get mingled up, you won't have any connections for days together. Same way, if the brain is damaged, many times the recovery of the brain also takes a long time, and this may not be complete also. If it is a complete damage, it may not recover. But since there is a neuroplastic or a reparative response in the brain, some amount of neurons still are able to recover. But since the brain is damaged in childhood, the type of recovery, the amount of recovery, the quantum of the recovery, and the quality of how much recovery takes place is very, very uncertain. In this situation, like how you said, the child would have had a lot of problems, and the development of the child over a period of time in this situation would be very less. And the financial burden, coming back to your topic, the burden would be excessive for such parents. And the child is alive, it is their own child, there will be a lot of love and affection. They cannot leave the child, nor can they do something about it. They will not have financial problems. It is like a catch-22 situation. This situation is very, very difficult for any parent or for anybody who looks into that sort of a scenario. Let me know what exactly happened in this case.
In this case, first the parents of the child had approached the MACT, that is the Tribunal for Motor Accident
Motor
Claims.
vehicle accident claims.
And they were awarded some 11 lakh and odd amount. And the parents of the child were not satisfied and they approached the High Court. In the High Court, it was decided that they will be paid some 25 lakhs or something. And agreed by that, they went approached the Supreme Court. And in the Supreme Court, it was observed that the IQ of this child was less than 20% of a child of her age.
Okay.
It was less than 20%. And her social age was like a 9-month-old child.
Okay.
So she was 12 years. And her brain was about 12-year-old child.
This is how you actually assess the neurological and the psychological disability. The neurological disability is something different. Psychological disability is something different. In psychological disability, there are various tests. In these tests, you find out whether the patient has any cognition, how much of cognition is there, how much of retention of the memory is there, whether there is a problem with the short-term memory or long-term memory, and how much of ability to overcome certain problems in normal daily life is possible in such a particular child. All these things are looked into, and then they compute the disability as whether it is a psychological or a neurological disability.
Yeah.
And this is usually permanent. And in such cases, like how you said, the 12-year-old child having the brain of a 9-month is very common, because the IQ and other mentation and other normal activities get hampered to such an extent that the activity of the child itself will be so low, it will be just behaving just like a 9-month-old child.
And she would not be able to understand what's happening to her, and she cannot be put back to her normal condition. That was what the Honorable Supreme Court observed. And the Honorable Supreme Court took into consideration that all these disabilities arose because of the accident.
Exactly.
So therefore, it considered the loss of earning, the expenses on treatment, then the loss or diminution to the pleasures of life of this child, because there was a loss of a particular part of the body, and the future earning capacity was also considered. So the Honorable Supreme Court granted compensation. It says it took into consideration the expenses relating to the treatment, the hospitalization, the medicines, the transportation of the child, the loss of earnings of family members, because they have to leave their work and come to a house, and they were from village.
And it's a sort of a constant expenditure for the child.
And it's a trauma also. It's a mental trauma for the family members too. And apart from that, it's a loss of future earnings for those people, because most of the people, they are not permanent workers. They will be in the unorganized sectors.
Somebody has to be there to look after the child all the time.
All the time.
Some adult has to be there. And that adult's earning capacity is hampered.
No, even if the child's mother is with the child, the home environment will be
and taking care of the other children normally also would be
difficult. So it's not that just because an earning member is not there, there will be a problem.
Even a non-earning member, family life,
even a non-earning member as a housewife is very essential for the well-being of the whole family. And the loss of future earnings, if she had been a normal child and had gone to to
School
job.
and started job,
Yeah,
having
and the attendant charges, those who had to look after the girl, and the pain, suffering, and loss of amenities, the loss of marriage prospects, and the future medical treatment that she had to undergo. All these were considered beautifully by
it's
the
a very nicely
device.
documented.
Yeah, it's a very. That's why
Very
I
good
think we have to
judgment
bring
from-
it to the public. This is a very recent case, 2020 case last year, and the Honorable Supreme Court referred or relied upon a judgment of General Manager, Kerala State Road Transport Corporation, Trivandrum versus Susamma Thomas and others. And it said that the the compensation should be invested in a bank, nationalized bank, that gave highest interest. So it was not only the parents' duty; it was the duty of the court also to order
how to utilize that money.
not only utilize, it has to invest the money. So the Supreme Court granted 62 lakh and odd amount of money, and it's said that, I'll quote the thing, the claims tribunal should, in the case of minors, invariably order the amount of compensation awarded to the minor be invested in long-term fixed deposits at least till the date of the minor attaining majority, and the expenses incurred by the guardian or next friend may, however, be allowed to be withdrawn, and withdrawal should be only for any emergency or contingency. So this was the this is a normal thing that it had relied upon, which is very commonsensical, and it is apt to the situation. And the interest should be earned in such a manner that is, the investment should be made in such a manner that the interest should cover the monthly expenses of the child. That was the instructions. And above all, the Honorable Supreme Court stated that this enhanced amount should be paid within 3 months from the date of the appeal, and it gave direction that the interest should be calculated from the date of the petition in the original tribunal. It's say, for example, if they had filed the case in 2012, and by the time of appeal it was around 2017 or 18 or 19, so the interest should be calculated from 2012.
12 onwards.
So that's a very
that's very good, actually.
a very good judgment.
That is the time that is lost for the child.
Yeah.
And that is the amount of money that they would have spent.
So the opposite party cannot state that since they have filed the appeal, the interest should be paid from the date of appeal. That was not the thing that has been held by the Honorable Supreme Court.
It's actually a very good precedent for many other.
And they have ordered that the amount shall be kept in an FD for 5 years, and every quarter the father of the child would be provided the interest amount. And the most important thing is that the tribunal should keep on renewing the excess amount that is required for the care of the child. It's not 62 lakh is fixed. So
as the days go by,
the
and
inflation
as the cost increases,
that had to be accounted for this child.
Excellent.
So this is
they have taken into consideration almost all the aspects of financial planning.
This is the Supreme Court's judgment is not only from the legal point of view, but also from the financial point of view and the neurological and the medical point of view. It's an excellent judgment. It is Civil Appeal number 735/2020. If anyone wants to refer to that, they can refer that. This is from the Honorable Supreme Court of India. Civil Appeal number 735/2020.
Thank you very much, Shripad, for giving us an excellent demonstration of how a family having a problematic child with respect to trauma, and how that child requires a lot of financial support, and how our Indian judiciary came up to the standards of this particular child and then helped them to such a great extent.
And this is related to the neuro aspect.
It is also related to the brain because it's a major severe head injury. And this is probably an unending problem. And if they try to do a lot of occupational therapy, cognitive
speech therapy,
speech and cognitive and various types of managements are there.
Physio.
And if that is done, probably we hope that the child gets better and then comes back to its normalcy.
And I think this will also be helpful for the advocates and the medical professionals also, apart from the normal parents and those who are suffering from such. And even if it's not a child, you can take up the compensation aspect also into consideration,
and
to
how the brain is damaged, how much of compensation is calculated, how the judiciary looks into this. and how the compensation can be given to the child and management of the compensation over a period of time. Thank you
Excellent.
very much.
Thank you, Doctor.
Thank you,
Doctor.
everybody.